Let's start with the good news. Early evidence from South Africa suggests that
those with Omicron were 70% less likely to develop severe disease compared to Delta.
And it gets better.
There was an 80% reduced chance of being admitted to hospital if you had Omicron versus not having Omicron.
But before you fall off your chair, maybe just
cool your jets.
Want the breaks now? Take a chill.
Firstly, the South African study hasn't been peer-reviewed, and it only draws on a small sample from early in their Omicron outbreak.
It's too early to conclude, and I think that's really critical right now because the data is a little bit messy.
Secondly, South Africa was recently smashed by a Delta wave that dwarfed Australia's. Those previous infections could have given its population a level of natural protection much higher than ours. Thirdly, even if Omicron is milder, it could still put some serious strain on our health system.
It might be less virulent as the Delta variant, but the numbers are big with Omicron. A fifth as severe, but 15 times as many cases is going to be a challenge to a health system.
At this point in the pandemic, we could all use a little optimism.
It seems to be a little milder, and certainly the vaccine is protective.
Those early signs are very pleasing, but obviously we need a bit more data and a bit more time as we move through.
So, just how hopeful should we be?
Well, Professor Peter Collignon is an infectious diseases expert and he joins us now. Professor, how much hope should we take from this study?
Well, I think we should take a lot of hope. I mean, one of the problems with Omicron, yes, it was a new strain and yes, it spread more readily, but it really isn't an issue unless it causes more severe hospitalisation and death, or if the vaccine doesn't work against it in real life, so we see a lot of vaccinated people in hospital. Luckily, neither of those two we're seeing, so that's good news. It's not good news that it spreads more readily, but the main people who are going to come to grief from that are adults who aren't vaccinated, which is still about 10% of adults in Australia. So where we have to really make an extra effort is to get those people vaccinated, because they're the main people who are going to come to grief as the virus spreads and as, you know, people who are unvaccinated get infected, and they're much, much more likely to go into hospital, get seriously ill and or even die if they get infected with the virus.
The New South Wales Premier said today that Omicron was probably 5 times less severe than Delta. Is he right?
Well, I'm not sure we can be that optimistic. Initially, even with Delta, it was thought, did it cause less disease than previous strains? But that's because you've really got to look at the age of the people who get infected. The younger you are, the less complications you'll have compared to somebody in their 70s and 80s. So that's really important. And also, you've just got to see what the effect of vaccination is in all of this with the age groups as well. And all the available evidence suggests that it causes less severe disease, which is really good news, and also that the vaccines still work, despite the fact that the strain has got some variations compared to previous strains.
New South Wales has just reintroduced masks indoors as well as QR codes, but only after cases have absolutely skyrocketed. Is it too little too late?
Well, masks have a place because they decrease your own risk probably 10 or 15% compared to not wearing it, but mainly in crowded indoor venues. And one of the problems in New South Wales, the super spreading events, are bars, clubs, gyms, where people don't wear masks anyway. So, look, yeah, they've got a place. It's more important in supermarkets, I think, that the staff wear masks and some eye protection, because this virus drops into your eye and you can get infections that way. And what's more important for everybody is to spend more times outdoors. Have a barbecue instead of an indoor dinner when you have your family, etc., etc. Outdoors is probably about a 20 times lower risk than being indoors. And I think the density limits are probably going to be more effective, especially for bars, etc., compared to the mask. So all of those things add up, though, to decrease the chance of transmission. But at the end of the day, this virus inevitably is going to spread and will continue to spread. We'll probably all come in contact with it in the next 3-4 years. This is going to continue. So the best protection we've got is vaccination, and whatever we can do to lower our risk, and the biggest thing we can do is be outdoors more.
Queensland's new Chief Health Officer, Dr. John Gerrard, said this today.
Not only is the spread of this virus inevitable, it is necessary. In order for us to go from the pandemic phase to an endemic phase, the virus has to be widespread. We all have to have immunity.
Is he right?
Well, I'm not sure I'd use the word necessary. I think it is inevitable that it will spread, and I think if we can control the spread, we're better off. until we get these extra people vaccinated. But that doesn't mean we don't do other things as well. Basically, the longer we can put it off, probably the better we are. But we just have to be realistic. Like, we can't all be locked down in home for the next year or two. That will have less spread, but it's not feasible or, I think, acceptable to the majority of the population.
Professor Peter Collignon, we'll have to leave it there. Thanks for your time.
Thank you.